The issue of abortion, which was not even the tail that wagged the dog, because in terms of this legislation, it's more like a flea, but it received a tremendous amount of attention and a lot of heat. And the National Organization for Women said this law is not good for women, talking about the health care law. And I'm just wondering what you think about that particular aspect of it.
Well, I was troubled by, the breakdown that we had over abortion, and I think you're right. Abortion was never really a central part of what we were trying to do with health care. I am satisfied, at least at this stage, that the administration came out with an executive order that, really kept the votes that we needed together to be able to move this forward. I do think that there are some really strong things in this legislation for women, not the least of which is paying for preventive services like mammograms and other kinds of screenings. Most women have to make healthcare decisions and are left without healthcare, and the new law ensures that that's true. Women gender rating, we get rid of gender rating. Women under the past paradigm were paying twice as much as men for their health care coverage and premiums.
But what about all the women who voted for Obama, who voted for you, who voted for Democrats, who have been waiting for a long time for Democrats to be in charge and are getting nothing on an issue that's very important to them?
Well, I think it's a good question. I mean, I'm disappointed. I believe in a full range of reproductive rights and services for women, especially as they're guaranteed under the Constitution, which abortion is. And so it's really clear that both among Democrats in Congress and with the administration, we have a lot of work to do. But being able to move forward this law at this time for millions of Americans who don't have health care and for women is really important. Did we get everything that we wanted? Did we get it in the way that we wanted? Absolutely not, but that's why it's a framework.